So educating people that the person who experiences the problem should not be making the decision. You see somebody who's in trouble, call for help.
Right.
Don't ask the person if they need help. Assume that they need help, get them help, and then you can apologize later that you helped them.
Right.
So that's sort of what we're trying to do in our annual wellness visits, our physicals, is preparing people so that, because life's going to happen.
Right.
Things are going to happen to us. We're going to try and prevent those things as best we can. We're going to try and educate people so that they understand these are the risks of things that look like you could be up for. I tell people, I said, I don't want to see you. I mean, I like seeing you. I like visiting with you. But my goal is for you to live life and not spend your time in my office or some other doctor's office. I want you to be able to go do life.
Good Saturday morning, ladies and gentlemen. Welcome to True North. I am your host, Eric Hobbs. Glad you're with us this morning. Nice, balmy morning here in southern Colorado. Not. Anyway, glad you're with us, and we are going to be talking about behavioral health and some seasonal depression or feelings that we might have. It's called seasonal affective disorder, and we're going to get into a little bit of that. But before we do, I want to just kind of get a taste for who's out there on the Chiefs side and who's out there on the Eagles side. Because a week from tomorrow, it's the Super Bowl in New Orleans. And this is a rematch from a couple years ago. And let's hope that, I don't know, I got mixed feelings about this one. I'm kind of digging the Eagles on this one. Yeah, because are we done with Mahomes? Are we done? Okay. Across the board for me, I have two spectacular guests, Dr. Michael Harper and Dr. Kendra Robison from Optum Health here in Colorado Springs. Well, first of all, welcome to the program.
Thanks.
Yeah, glad you're here.
Thanks for having us.
Yeah, we're going to have some fun. So, but I got to get a first read on you two about this game. Do you have any dog in this fight?
I'm a Bengals fan, and really more of a college fan. So I just shout out to the Ohio State Buckeyes, who just won the college football, the national championship.
Yes.
So, but I'm going to go Eagles. Little tired. I don't want to three-peat unless it's my team.
Right.
So I'm going Eagles.
Hey, if the Steelers can't do it, nobody should be allowed to do it.
No Steelers.
No Steelers.
Bengals.
Come on, Michael. I thought we were going to have some fun. Okay. Dr. Robison, any dog?
Broncos all the way.
Okay.
So,
so
watch.
No.
Yeah. And yeah.
All right. Well, those two folks are going to help us understand what's going on in the behavioral health realm, as well as just good primary care, good mental health care, all that good stuff. Because, in this time of year, I don't know about you guys, but the shades of light that disappear. I love summer in Colorado because it's light in the morning and it's light at night. But I'm not used to this. I'm from South Florida, so it gets so dark here, and I just want to make sure that folks have some tools in their toolkit to make sure you can get through some of these doldrum months and understand how all this fits together. So if you want to look at Optum online while we're having this conversation, please do so. Go to optum.com/Colorado, and you can take a look at their website. So doctors, welcome. Let's get to know you a little bit. So we'll start with Dr. Robison.
Sure.
Where are you from? How'd you get here? All that good stuff.
Well, I'm a Colorado native, so proud Coloradan. I'm a physician, internal medicine by training, and I left for a while to train, and I'm an osteopathic physician.
Very good.
And came back to the Springs where I was born and raised. So.
You were born and raised here?
Yeah.
Okay. Where'd you go to high school for those who know the area?
Colorado Springs Christian School.
No kidding.
Yeah.
Okay. Up on the hill there? Mm-hmm. Very good. Yeah. And where'd you go to medical school and then residency?
So medical school was at Chicago College of Osteopathic Medicine.
Okay.
And then back to Denver for my residency training program in internal medicine, which was St. Joseph's.
St. Joseph's, okay.
In Denver. So
very good. Well, welcome home.
Thank you.
And when did you join Optum?
So I've been with Optum now for 15 years.
Okay. Sorry it's not working out for you. Okay. Dr. Harper, welcome.
Thank you.
And give us a little background on you, sir.
I am not a Colorado native.
Okay.
I am, as I mentioned before, Ohio native. I grew up in Dayton, Ohio. I went to Ohio State University for medical school. Practiced in Ohio for 25 years, and this might segue into the topic today. My lovely wife, who I adore, sort of affected by the seasonal affective disorder, the gray days of Ohio. If anybody's ever been there, this time of year, it's the sky's gray, the trees are gray, the ground's gray, the grass is gray, and the people are scarlet and gray. And so looking for a place that had more sunshine. Yeah. So we searched the country and found wonderful Colorado Springs with its 300 days of sunshine. And so been here since 2020, got here just before the pandemic, and practicing family medicine since graduating in 1992 from medical school.
Very good. Well, and as we digress here for a moment, that little community college that you went to in Ohio, national champions.
Yeah.
Were you just parked right in front of it the whole time?
I will tell you, I may not be the best fan in the world because I did watch almost the entire thing, but I get incredibly nervous watching their football games.
Oh, I totally get that.
Growing up, nervous about it, and so I generally actually try to avoid the games because my blood pressure goes up, my heart rate goes up. My wife is like, "What's the matter with you? You're a completely different person." So I actually try to avoid the games.
That's actually pretty funny.
But this game, playing Notre Dame, my father went to Notre Dame. Oh. And I actually spent my first year of college at Notre Dame. So I've always been a Notre Dame fan.
Okay.
So it was one of those games where I couldn't lose.
You couldn't lose, yeah.
If Ohio State won, I was going to be really happy. And if Notre Dame won, I would be happy.
So be it.
So I watched that game, and it was fun.
Okay. I get that, what you're saying about being nervous, because I'm an Ole Miss graduate. And that team drives me to drink. Okay. I mean, they're either amazing. If I don't watch them, they do really well. If I watch them, it's really tense. I don't do well. I might need some counseling there. I don't know.
I'll tell you, during the game, there was a point at which one of the announcers called out that Ohio State does not fumble the ball.
Yeah.
They just don't. They haven't fumbled in forever. Next play?
Fumble. Boom.
Yeah. I've looked at my wife and was like, why do they do these things?
Why do they do that? Yes.
So
it's almost like they're taunting you.
Yeah, they know.
Well, let's get to know Optum now a little bit too. So how does that organization work? Because it's one of the main primary care outlets here in the region. Mm-hmm. So how does it work? And are you guys accepting new patients, all that good stuff?
Yes, we absolutely are accepting new patients. So we have Optum locations across the Pikes Peak region. So really in all of the quadrants of Colorado Springs and beyond. We have 12 different locations. So we focus primarily in primary care, adult and pediatric medicine, and we also have some specialty services as well.
Okay. Some of those specialty services, pulmonary care, others, do you have them off the top of your head?
Yeah, so pulmonary, we have sleep medicine, dermatology. We have an orthopedic nurse who does a great job for us. Those are our main internal specialty.
Okay. And of course, pediatrics as well, right? Mm-hmm. Yeah, you have good pediatrics practice. So the behavioral health side, I mean, this has become a less taboo subject overall in our culture, which I love because I think we're finally starting to have an honest discourse. When you don't feel right, it's okay to actually have that conversation with your physician. You're not preventing them from anything, right? So what do you attribute that to? I mean, what have we traversed in terms of a culture that allows us to talk about this better?
That's really a great question. And I think it's just sort of an evolution of people recognizing that there's no such thing as normal. Whoever's normal out there is probably abnormal. And recognizing that it's okay to talk about those sorts of things. It's on the radio, it's on television, it's in newsprint, and doctors are really being educated on mental health. I was actually on the phone with my son's friend who's in medical school, talking with him last week, and he's trying to decide what to go into, and he's always wanted to be a psychiatrist. And I was trying to encourage him to do that because we need psychiatrists. But he's questioning himself, and he said, well, what about what you do? And I'm as a family doctor. I said, well, 80% of what I do is mental health. I said, every person that you see, you ask that question. How are you doing? How are you holding up? Mental health plays really strongly into your physical health. It's hard to go to the gym and exercise if you're mentally not feeling it.
Yeah.
So there's just the conversation being started is a huge part of it.
Our culture puts a lot of pressure on us to be successful, do all those things. And of course, social media adds a dynamic to this that, we could probably spend a year talking about. But I mean, are you seeing more and more people coming forward with this volitionally in terms of, doc, I just, I feel okay, but man, I am worn out.
Yeah, I think somewhat. I think still there's maybe a little bit of stigma or some people are afraid to talk about it. So I think that's part of our job, right, in primary care, to really develop those relationships with our patients and ask those questions, because sometimes that can be hard to bring up. But I will say overall, I think we are seeing a little bit more comfort with that. And I think that's where primary care can really help more than ever before.
Well, because you guys are the first foray into the healthcare continuum. So you're going to see that first and foremost. And are physicians feeling more comfortable saying, gosh, patient X, Y, or Z, you may want to consider some yoga or some therapy, or, because that didn't roll off the tongue 10 years ago either.
No, it really didn't. And I think physicians are being better educated in that. As they're in the medical schools, they're talking about that more. We talk about it quite regularly with having behavioral health in our offices. So it's a topic of conversation that comes up on a regular basis. And it really is something that if you're not asking that, then you're probably not doing your job.
You're leaving something on the table.
You got to kind of ask where their headspace is, what's going on in their world, what's going on in their life. Sometimes that's the first question, and sometimes that's the last question. They've laid everything out for you, and as you form your plan, you just kind of ask that, what's been going on in your life? Yeah. And then there it is.
Yeah. And then you are developing a heightened sense of what might be going on as well.
Yeah.
In there. Okay. Well, Doctors Harper and Robison are hanging out with us today, and we're going to be getting into a little more specifics around seasonal affective disorder and some of the other behavioral components that you may be facing. And this is a very healthy conversation. I know men tend to isolate sometimes. Professionals tend not to want to talk about it in certain arenas, but we're going to break down some of those barriers and help you understand how to work with these tools. If you want to listen and look at their website while we're talking, go to optum.com/Colorado. We're back with these two fine folks in just a moment. All right, we're back here, second quarter True North on a February. I can't believe January is down. It's done. It's over. We're now 2 months into the year. Welcome to February 2025. Ladies and gentlemen, I have Dr. Kendra Robison she is the Senior Medical Director of Primary Care with Optum in Colorado Springs, and family medicine physician, Dr. Michael Harper. Welcome back, folks. Glad you're here.
Thanks.
Thanks for having us.
So we've got, in Colorado, we have beautiful landscapes. We have 300 plus days of sunshine. At least that's the way they market it to us. And I think actually we do. Great vistas, great outdoor lifestyle, but seasonal depression or seasonal, affective disorder still affects quite a bit of the population. And, you and I were talking offline here, Doctor, about, the further north you live and the shorter the days, we all know we're going to experience, those longer times of darkness than we are the daylight. And it actually it is a real thing. And we all experience it. We may not be able to point to it and say that's seasonal affective disorder. I know what that is, but we're feeling different than we do in the summer months. So let's unpack what it is and then help folks understand, what are some of the tools we can use to navigate these longer months, longer nights.
Sure. Seasonal affective disorder, it's got a great acronym, SAD.
SAD, yeah. Well, it's accurate.
Yeah. And it really does kind of describe what it is. People feel down. They feel depressed. They feel hopeless. They feel lacking in energy, lacking in motivation. I like to describe it as slogging through mud. Mm-hmm. You got to keep doing what you do, but you feel like you're just a little heavy, a little more burdened. And it's not just one day. It's not 2 days. It's usually 2 weeks or more that this is hanging on. There's a lot of folks that it comes around every year to them, and they don't necessarily know why they're feeling that way. They're looking kind of at the winter and going, oh, no, here we go, another winter, heat winter. There's a lot of, like Dirk pointed out, Colorado is a beautiful place. You got beautiful days, glorious mornings like today. Mm-hmm. And people can, during this time of year, can look at these days and look at those mountains and look at those blue skies and go, blah. Yeah. Can't get motivated. And there are things that you can do. The having a plan, knowing that it's a real thing, makes a big difference. Knowing that you're not alone, that there's millions of people across the country that are experiencing this. The farther north you go, the worse it seems to be. You get up to Montana where the days are really short. I guess the days are all 24 hours, but the
true.
The daylight hours are much shorter.
Yeah.
Getting up in the dark, going to work, working during the daylight, and then going home in the dark again gets to be tough. Mm-hmm. Talking to your doctor when you go into your primary care doctor and you explain everything that's going on with you, making sure that they understand how you're actually feeling emotionally, mentally. Mm-hmm. Therapy, not necessarily physical therapy, though exercise does help. Psychological therapy, sitting down with a behavioral health specialist who can talk with you and help you understand these feelings are normal and then help you kind of work your way through it. Medication helps. Mm-hmm. I was telling Dirk that, I've had patients over the years that they recognize the winter's coming and they always get down. You start them on a medication, the medication helps, mm-hmm. and then you take them off it in the spring and they're happier campers.
They're good to go.
Yeah. Okay. Like I said, millions of people have this. I was a little surprised as we were looking this up, that women are affected more than men. And we joked a little bit that maybe it's because they're hanging around men a bit more because we're stuck inside too.
Yeah, I think that's realistic.
I was trying to come up with a way to describe it. Some people like pictures painted for them. And I think like if happiness and life is a beautiful Colorado sunny day, everybody wants to go outside. You want to sit around, talk with your friends and enjoy the sunshine and laugh and just feel good. That's what it feels like to not be depressed and not be sad. Mm-hmm. This past Saturday where it snowed, got up in the morning, it was gray. The sky was gray. Everything was gray, and it stayed gray all day long. It continued to snow, and everybody, I think, was doing like I was, wow, I wish I was skiing, but since I'm not, dang, why doesn't it stop? It's that feeling all day, every day. Mm-hmm. And it gets in the way of your production. It gets in the way of your work. It gets in the way of your relationships. It gets in the way of your well-being. It gets in the way of your sleep. And if if you can address that, then it's going to make all those things better.
Can this manifest itself into a more serious condition if left unidentified, or do people just kind of ride it out and get to April or May and move on from there? Because it sounds like, I mean, first of all, is SAD, seasonal affective disorder, is that on the spectrum of depression?
Yes.
Is it a clinical depression? Is a diagnosis?
Yeah.
Okay.
Yeah.
And so when somebody presents to you with that, you can kind of walk them through some like some therapies that we just talked about, right? Socialization, exercise, maybe speaking with a behavioral health counselor, and being able to talk about it openly. But if somebody doesn't, so maybe the older generation, or maybe some of the more stoic younger generation, if they just don't want to talk about it, I mean, could it manifest itself into something more profound?
Great question.
Okay.
And I would say yes. And I mean, probably the most profound thing it could roll itself into is suicide.
Yeah.
You get down enough, then that's something, and that's on the rise.
Right.
We're seeing that a lot. You're seeing more of that in young kids, seeing that in adolescents, seeing that in adults. Being sad, you tend to be less active. We tend not to eat as well.
Sure. Yeah, true.
We have a tendency to treat ourselves poorly when we're down. So we make poor choices. We drink more, we smoke more, we exercise less. We decide we need donuts because, well, I'm having a bad day, so I need to have a donut.
Everybody
not that donuts are bad, but they're not great for us, but they really taste good. So all those things can impact our overall health. They can affect our blood pressure. They can affect our blood sugar.
Yeah.
As we put on weight, it affects our joints. That kind of circles back around to our self-esteem, which can kind of make the whole circle come back around and make the problem worse.
So what's actually happening with us when we're experiencing seasonal affective disorder? I mean, obviously the light is a component of that. How does that work is it a chemistry issue? Is it just merely a psychological issue that we know we're going into a period where there's shorter days or daylight hours?
I think it's a complex problem in there. So much of it is chemical. Some of it I think is learned behavior that we learned that we don't, we dread something coming. So we prepare for that in the way that we've always prepared for it. And I'm sure there are other factors in there that are causing it to happen that we're not entirely aware of.
Yeah, I mean, I think there truly is probably lower levels of serotonin, and that's what our medications help to increase those levels of that happy hormone, serotonin, and chemically that can happen for some, especially with the daylight and how that affects our bodies. Vitamin D can be very important, and obviously when the sun is less, we're getting less of that. So that's a good vitamin that actually folks can start, and sometimes that does help just getting out in the sun, right? So when we do have these beautiful bright days like today, get out and let that natural sun soak in, and I think we all feel that warmth of the sun, right? And it just makes you feel better.
It does feel good.
Those are just some natural things that you can do, because it can be a normal physiologic process that we're all experiencing just as humans. And so I think that is the distinguisher, right? That we can all have this. This is very common. And it doesn't necessarily mean that you clinically have seasonal affective disorder. But as Dr. Harper was saying, when you're really starting to experience it every single day, all day long, you just can't seem to get out of it. It's been more than 2 weeks. That's really when it's time to see your primary care provider and see what else they might recommend.
Oh, that's very good. And this tends to, women tend to pick up on this more. I caught that earlier. So unpack that a little bit.
Yeah, I was interested to find that as well, that it affects women a little bit more. I don't know why the reason per se, but it may be that women do seek care for things like this generally more than men. So it actually may be that we're seeing.
Very good.
That's actually causing the ratio. But I think anybody, right? It can happen to anybody. Sure. So it's something to be aware of.
How about the kiddos? I mean, as a parent or certainly a provider, you can see that disposition in a kiddo who might be presenting with a little seasonal disorder. But are they more resilient by and large, or does it really affect everybody equally?
That's a toughie too.
Yeah.
A lot of the mental health problems, the behavioral health problems develop before you're 14 years old. Mm-hmm. So they are definitely affected by the SAD and so many other mental health problems out there. Resilience, it's tough. I mean, you remember being a kid.
Sure.
And you didn't know what you didn't know, so you just kind of keep going. You don't know what's normal and what's not normal, what other people are experiencing. When you start to kind of realize that sort of stuff, maybe kids today are better about talking about how they feel, but back when I was a kid, you weren't telling somebody, boy, I'm feeling really nervous right now.
Yeah, absolutely not. Yeah,
we do that. I mean, before we started here, we're nervous, or I am. Kids are tough, but it's one of those things where making sure that you're asking them, really listening to what they're telling you. Teenagers are tough. They won't. Teenage boys won't tell you anything that's going on in their world, and teenage girls will tell you everything that's going on in their world. And
I know that too well.
At least that's from my experience. And making sure that you're paying attention to what they're telling you, what they're actually trying to say in your busy life and busy world can really make a huge impact in their daily life. Winter's tough. No question about it. Well, if you're facing the seasonal blues, folks, we're going to give you some more pearls of wisdom here from Doctors Harper and Robison from Optum Health. So if you want to look at it online, go to optum.com/Colorado. You can find one of 12 clinics here in El Paso and Teller County. We're back in a moment. All right, ladies and gentlemen, welcome back to the third quarter here at True North, February 1st. Hopefully you're on your second cup of coffee, listening to this great conversation. Hopefully is edifying for you. Take a few notes, but also if you want to look online while we're having this conversation, please do so. Go to optum.com/Colorado. There's a lot of clinics here in Southern Colorado. If you're looking for access to care and a primary care provider, it's a good place to start. And we're talking today about something most of us experience. It's that seasonal affective disorder, that kind of awkward blues that we face somewhere around October, November, and it maybe spreads out into March and April each year here in Colorado. Now, if you're in some of the more southern states, it may be a little less profound, and surely as you get closer to the equator, you don't necessarily experience this particular thing, although you may. But as you get further and further north above the equator, our days shorten. We have a lot more darkness. We go home in the dark. We go to work in the dark sometimes for a lot of us. And, it can just feel like, I just don't feel my best. And that could be something as simple as, and maybe not overly simple, but something as simple as seasonal affective disorder. Or it might be telling you some other things too. And we just want you to be able to make some discernments and have an honest conversation with your physician or your provider as you go in and have those annual well checks, and just have an honest conversation with them about how you're feeling every bit as much as the physiological components that you might be facing. So across the board for me, I have the Senior Medical Director of Primary Care with Optum, Dr. Kendra Robison, and Primary Care Family Medicine Specialist, Dr. Michael Harper. Thanks for being here, guys. Thanks again for having us.
Really appreciate you. So it's, this is a 1-hour consultation, and this is a very expensive hour for Optum. So I want to get as much out of this conversation as we possibly can, because your expertise in various areas, you're an internal medicine provider, you're a family physician, and, it's not often we get to talk with somebody like this. Patient encounters are pretty much regulated now to 15, 20 minutes, right? We understand that as patients, but you understand it as a physician. You want to maybe tell them a lot more. So let's give them as much as we can here today. So this seasonal affective disorder, it's a real thing. Okay. It's not something that it means you're weak or you're soft or you're just out of sorts. I mean, it's a real thing. It's a physiological experience that we're all having.
Absolutely.
Yeah.
Absolutely. The things that we kind of have to think about is once you recognize what it is, what can you do about it?
Mm-hmm.
You know, what kind of steps can you take? And behavioral health is one of those that is very important. We spend a lot of time, I think, trying to convince people to get the help that they need. And once you recognize something and you suggest that to a patient and say, I think maybe a behavioral health specialist, a therapist would be a good idea, they'll say, well, I don't really want to unload how I'm feeling onto a stranger. And we hear that all the time. And I try to come up with different ways to get people to talk with them. And one of the things that they'll often say is, well, I have my friends and I have my family. Mm-hmm. And I'll then say, are they therapists? And they're going, no, but they're good listeners.
Some would like to think they are, right?
So you use examples like, well, okay, you can fix some things on your car, right? You know, you can put gas in your car. You might be able to change the battery. Mm-hmm. You can change the windshield wipers. And if you're really good, you can, rotate your tires. And there's people out there who can do everything on their car, and they don't really need any help with it. But most of us go to a stranger and hand over a piece of equipment that we've paid a lot of money to, and had them fix it. Mm-hmm. And then, we just hand it over and pay them money. Mm-hmm. You're the most expensive piece of equipment you've got. You're irreplaceable. And you think about going to a specialist, a professional who can understand how you work and can help you put yourself back together. Mm-hmm. And that's something that we have here, at Optum with behavioral health specialists in our office. Mm-hmm.
So this is the integrated model that Optum has developed. So you go in for a physiological appointment, maybe a few primary concerns, a cold, consistent migraines, whatever it might be. But then you as a provider may observe something, or they may say something to you that indicates, well, there might be a little something more going on here.
Yeah, exactly. And that's our job. We really consider that our job. How are you doing today? And maybe you're just there for some other complaint. But, I think as physicians, we're pretty intuitive and sometimes we can sense that. And so we do ask because we also now can actually offer help right there in the clinic, even that day if needed, if somebody's really going through a difficult time. We've developed integrated behavioral health, and we have those in all of our locations across the Pikes Peak region now for Optum. Okay. And so a model where, yes, the behavioral team is in our clinics and partners with our primary care providers to come alongside the patients and really provide that integrated care for their overall health.
So what level of professional are these behavioral health specialists? Are they LCSWs, or where do they fit in the professional realm?
It's a variety. So we do have social workers, therapists, and other mental health care professionals. And then we connect in with the community if somebody does need to see a higher level care, or somebody, an actual psychologist or even a psychiatrist. We can then connect into the community very quickly to get them those services.
Okay. So you have a roster of the availability, and regrettably across the nation, I mean, access to psychologists and psychiatrists, I mean, it's sometimes hard.
Oh, very hard. Yeah. Very hard. And having it in our office, if again, you're kind of going through the sales pitch, if I will, of trying to get somebody to do what you're suggesting they need to do. And then you say, well, okay, we're going to put in a referral, and somebody's going to call you in 2 weeks about, not that it takes 2 weeks, but if they're going to call you, you've maybe lost your moment to get them into a therapist. But if you can say, we've got somebody right here, right now, that we can bring in the room to sit down and you can meet and kind of start this process, they're more likely to go, okay, well, yeah, I can meet with them. Okay. And they don't have to leave the room. They'll come in the room and talk with them and then set up a plan so that they can come back and follow up.
Okay.
It's very powerful to have to know that when you're in crisis, you've got, you can call if you're having a heart attack, we can call the squad to come, or we can help you. But when you're having a mental crisis, sending somebody out the door and saying, we'll call you, versus, hey, here's your help.
Somebody's here right now that can help you out. And those things happen. I mean, when you could be in a regular patient encounter and all of a sudden, you just feel overwhelmed with everything that's going on. You're like, could be professional challenges, marital challenges, who knows? Not just seasonal affective disorder, but something more significant. You guys have the resources to pull somebody in right then and there.
We do.
So, what does that look like as far as their plan is concerned? Is there a package or like a series of 3 consultations that a patient would go through? How does that work, doctor?
Yeah, great question. I mean, usually, most patients are able to schedule, their appointment before they leave. And it really depends on the patient, and what they're going through. And so our therapists, do a great job of assessing how many sessions they may need. Mm-hmm. I will say our services are more of a temporary service. And then if they do need ongoing, therapy, that's when we'll connect into our community partners. But yeah, our therapists do a great job of evaluating that.
Okay, very good. Well, let's talk about some of the different ways that, back to seasonal affective disorder, how this affects different categories of folks. So you and I as men will tend to be a little more stoic about it. Is that an accurate assessment? Because I don't generally talk about how I feel all the time. Is that consistent across the board with men?
Stereotypically, yes.
Yes.
Okay. Men tend to, I don't know. I try to describe this to patients a lot. You're sitting there in the room, and if the spouse shows up with the patient for an appointment, there's always just a little bit more going on. So if the man's sitting there and he's married to a woman and he's talking away and she's shaking her head in one way or another, up or down, yes or no, agreeing, disagreeing. The man will go, okay, well, let's just do that. And she'll usually go, well, we've got let's just talk about this just a little bit more. I use this a lot with patients that women live longer than men. And I mean, that's statistically a fact. They live longer than men do. Mm-hmm. And in my humble opinion, there's 2 reasons that they do. One, they're stronger than we are. Mm-hmm. I mean, heck, they give birth, mm-hmm. they deal with us, they help, they primarily raise the children, they work, they do all this stuff. They're stronger. Maybe not, can't lift as much, but by all accounts, they're stronger than we are.
Right on.
And the other point is they're smarter than we are. Men will see a problem and they'll go, well, maybe it'll go away. Maybe if I just wait long enough, it'll disappear. Women will go, that's a problem. We really need to address it. And let's see if we can get around it and see if we can make a change so that won't, affect us anymore. And I think that, again, that's just my humble opinion about it. So yes, men will come in and they'll have held something in forever. And they'll want it fixed now. Mm-hmm. Women will deal with it as much as they can, and then they'll come in way before the man does, mm-hmm. and say, "Let's get on this. Yes, I want to see a therapist. Yes, I want to do what it takes to get this done." Whereas the men, you have to convince. You've got to, okay, let's talk about your car. Let's try and get you there. Now that's changing. That is improving.
Sure.
Men are much more amiable to going to see a therapist and talking about these things. And it's things like this, where we're on the radio or you're on television, you're on YouTube, all those sorts of people talking about it, celebrities talking about it, ordinary people talking about it. Not that celebrities aren't ordinary, but that all those sorts of things make an impact on our ability to get to better health.
Indeed. All right, Dr. Michael Harper and Dr. Kendra Robison are hanging out with us here today. And when we come back, I want to talk about us as patients and how we can give our physician, our caregivers, the best opportunity they can to give us access into how we're doing and what some of those conversations might look like. How to utilize your primary care provider in a most productive way when we're back in a moment. All right, fourth quarter, True North here on a February 1st. Glad you're with us. Dr. Michael Harper and Dr. Kendra Robison are sitting across the board from me, both from Optum Healthcare here in Colorado Springs. Actually, Optum is across the state of Colorado. You can find a clinic here. If you're listening elsewhere besides Southern Colorado, just go to optum.com/Colorado, and that will help you find a care clinic here in your region. Doctors, welcome.
Thank you.
Glad you're back.
Nice to be here.
It is good to be here. And, we've talked a lot about seasonal disorder. That is something very real. I think a lot of people want to maybe blow that off and say, I'm just feeling a little blue today. But when it extends past a few days, maybe a few weeks, it might be something more significant. And that's a good opportunity, maybe a good sign that say, you know what, maybe I'll just check in with my provider and see what's going on. If I'm able to shake this off, maybe do some, like you said, some serotonin, make us feel a little better through these darker days, not metaphorically, literally darker days during the summer months here in Colorado. That's certainly a great tool that's accessible to us. One thing we left off with how to utilize your patient encounter to the best of your ability. As a patient, you have a responsibility to be forthright and forthcoming with your physician. Tell them what's going on. So being organized with your formularies, with what's you've been experiencing, aches and pain, being able to articulate, almost preparing for the visit, to articulate what you're feeling physiologically as well as emotionally and mentally, I think it's an important part because we do get such a little amount of time with you each time because you're seeing so many patients and there's just a lot to unpack. So what are some pearls you can give patients how to prepare for their primary care visit and get the most out of it?
Well, I think you kind of said some really good things there is, know what you want to talk about. Mm-hmm. Understand that there is a limited amount of time. I had somebody last week who came in with a legal pad that had 13 things written down on the legal pad that they wanted to talk about, and that's great. I mean, it's wonderful that they're thinking about their health. They're thinking about all the things that they want to talk about and want to get an opinion on. Understanding that there is a limited amount of time that we've got patients all day long, and they're as important as the next patient. Each one of them is important.
Of course.
The ability to focus on 13 different things in a relatively short amount of time may be a little bit straining on that time constraint. So focusing it down on just a few things and knowing that, we'll get to what we can. And then, come on back. We're happy to see you anytime. Mm-hmm. The other thing is if you're on medication, either bring your medications in, put them all in a bag, bring them all in so that we can go over them and make sure that the list that we have in our office and on our EMR is the same as what you're taking. You may be seeing specialists who've given you something else. Mm-hmm. You may have gone to an urgent care and they gave you an antibiotic or some other kind of medication. And we like to be able to know those sorts of things. If you can't bring them in, write them down. Mm-hmm. Those things are two really simple things I think you can do.
Yep.
Yeah, no, I totally agree. And I'm an internist, and so we deal with a lot of different chronic conditions. And sometimes I do tell patients we're just gonna take it slow, and we're gonna kind of cover each area, but we'll get to the different concerns that you have because they're all really important to us. But we want to take that time. We want to be making sure that we're not missing anything, and that we're really focusing on those problems for the patient. So I would agree, really prioritizing what's most important. And sometimes we'll prioritize it for you in that list of 13. We'll say, what do you mean chest pain here, right?
Yeah.
And that means your doctor is really focusing on what could be most harmful for you, right? So we do that.
Yep.
We try to help you to prioritize your list as well. Absolutely. And that's okay. Bring your list, but then, you may find that we'll just sort of try to parse it out and have you come back multiple times so that we can give it that good focus.
Yeah, because a 15, 20-minute patient encounter or whatever they are today, 30 minutes, that is a lot to unpack. 13 primary concerns is pretty heavy lift.
And they were all good concerns.
Yeah.
And the other thing that you can do is not wait till you have 13 concerns. Mm-hmm. make an appointment. If you're a senior, you get an annual wellness visit. You come in, we go over all your chronic medical conditions. We'll go over making sure that you're meeting all the screening things. Make sure you've had your colonoscopy, make sure you've had your mammogram, bone density scan, make sure you get your eyes examined. All those things that can be preventative, so that list of 13 things may actually get shorter because we're helping to prevent things. Medicine used to be, something's broken, let's fix it.
Right.
Now let's fix it, or let's prevent it from breaking. We can't stop everything, but if we're on top of those things ahead of time, then we got a better chance.
Yeah.
If you're treating somebody for hypertension, and we always ask them, do you have chest pain? Do you have heaviness in your chest? Do you get winded when you're walking? Do you get winded when you're exercising? No. And then you say, well, if you get those things, what are you going to do? And they say, well, what should I do?
Exactly.
One, if it stops, call me. Two, if it doesn't stop, call 911.
Right.
I'm struck remembering a time where somebody was standing at a coffee station and a man was standing next to him, and the man was holding his chest, and the person who was drinking the coffee looked at the man and said, "Are you okay?" And he goes, "Yeah, I think I'll be fine. Just a little chest discomfort, but I think I'll be fine." And so the person with he goes, "You want me to call 911?" No, I'm okay. And they said, "Okay." And the man took about 2 steps and collapsed.
Ooh.
So educating people that the person who experiences the problem should not be making the decision. You see somebody who's in trouble, call for help.
Right.
Don't ask the person if they need help. Assume that they need help, get them help, and then you can apologize later that you helped them.
Right.
So that's sort of what we're trying to do in our annual wellness visits, our physicals, is preparing people so that, because life's going to happen.
Right.
Things are going to happen to us. We're going to try and prevent those things as best we can. We're going to try and educate people so that they understand these are the risks of things that look like you could be up for. But I tell people, I said, I don't want to see you. I like seeing you. I like visiting with you. But my goal is for you to live life and not spend your time in my office or some other doctor's office. I want you to be able to go do life. Come back and see me anytime you want. Please come back and see me in 6 months. But be out there and live life.
Absolutely. Is there a kind of a cadence you want patients to have at certain age groups? So obviously pediatrics, from birth to a certain age, there's going to be regular routine check-ins. For that adult group in the middle, right? Say 20, 21 years old to maybe 50 years old. They're at the height of what should be their healthiest years, idealistically, but do you recommend every patient come in at least once a year for a quick checkup and just to make sure we can have those conversations? How do you advise your patients to utilize the system?
Yeah, we really would recommend everybody should come and get their physical.
Like a dental cleaning, right?
Yeah, just like you prioritize your teeth, prioritize the rest of your body. And so usually our insurance is going to cover that healthy visit. And so, yes, we really do recommend that. Now I'll say, in your 20s and 30s, if you're very healthy and no family history, most probably go, 2 years, 3 years. But really, especially as you start getting into the early 40s, it is really time to see your provider every single year. That's also where a lot of the screening tests start to begin, right? So for females, our mammograms at 40, and they've actually lowered the age for colonoscopy. Now it used to be 50, and now it's 45, right? So high rates of colon cancer. So that's really when it's time. It's definitely, at 40. But again, it's important for everybody. And again, it's that time where you can really, all those preventative measures that you can start to take, you can prevent, things from even happening, prevent that diabetes before it even starts. We can order some of those screening tests if you're at higher risk. And then just taking time, right, to talk through how are you doing? How is your mental health? How is your physical health? Are you smoking? Are you drinking alcohol? Are you exercising? And so we'll take those opportunities as well to talk with you and advise you and give you some ideas and then empower you, right, to take care of your own health.
Well, and if you're feeling physically pretty well and you've got your physical health in some decent order, it helps us combat the mental and emotional stress that we often are faced with. Is that a fair assessment?
Yeah, I loved how you did the cycle, right? That it then starts to go to this. So maybe share that again. I really thought that was good.
Well, can't remember how I said that, but here's kind of the way I try to think about things. Like, so imagine you've had a bad day. Mm-hmm. Yeah, everything's gone wrong. You know, you stopped at every stoplight. People were going really slow in front of you when you were driving. People were cutting you off. Your boss handed you extra work. You know, the dog pooped in the living room. I mean, everything went wrong. Okay. And then you're walking down the hallway and you bump into a door and you hit your head, and that pain of hitting your head is just worse. It's like, oh my God, I can't believe how much that hurt hitting my head. Right. And it was the buildup of all that other stuff that made that hurt so much. Now switch the day around where you had the best day of your life. It was a beautiful sunny Colorado day. And you know, your wife loves you. Your dog always goes outside. Your boss gave you a raise. You know, you made every stoplight. Everything was wonderful. Yeah. But you hit your head again, and you go, "Oh, man, my head. Huh, that was big deal. Big deal." So your mental health and your physical health are so tied together. So that if your mental health feels like the bad day, every bit of your physical health is going to suffer from that. Right. You're not going to eat well. You're not going to sleep well. You're not going to treat yourself well. Your blood pressure will go up. Your blood sugar, all those things will circle back around, and then your mental health will get worse. Mm-hmm. So if you can do the other, and then you're going to be in a better place.
It's a good day. Dr. Michael Harper, Dr. Kendra Robison, got it right, from Optum Health have been joining us today. Thank you both for your wisdom and your insights. We appreciate it. And folks, if you have some seasonal depression or are affected by the light and day, please go see your provider. If you want to work with Optum Health, do so at optum.com/Colorado and find a clinic near you. Thanks for being here, folks. We'll see you next week.